So Dr. J and I have both had our journeys with cPTSD, somatic pain, and trauma in our lives. And this is actually what led to us creating the LUMNA Elixirs. And we'll talk more about our journey with this at the end of this discussion. But right now, Dr. J, I'd love if you could share how the LUMNA Elixirs support people with things like trauma, cPTSD, and somatic pain.
Yeah, of course. So I think the biggest thing that I've noticed in working with patients with cPTSD, because probably 50 to 75%, if not more, of my patients, especially with complex chronic illness, have cPTSD. So I work a lot with this demographic, again, based on my own experience, but through the clinical outcomes that we've done and through working with people with cPTSD and using LUMNA, Calm and Uplifted with these patients, and also based on my own experience and the research behind the constituents, I would say the number one thing that Calm and Uplifted does for people with any kind of trauma, cPTSD, or somatic pain is that it increases ventral vagal tone. And what that essentially means is the vagus nerve, or the parasympathetic branch of our autonomic nervous system, regulates rest and digest, connect, and create. So by increasing ventral vagal tone, we have better access to rest, better digestion, better connection, heart to heart with other people, and more access to creativity, because we can't be creative when we're just surviving day to day. So what this looks like practically is increased feelings of safety, calm, clarity, and mental balance or presence. What our elixir also does is reduces the severity and frequency of triggers when they do occur, especially with continued use over time. The frequency and severity of those triggers go down, and it can also be used acutely during triggers to kind of defuse or give someone space from the trigger event. And then another thing that increased vagal tone or ventral vagal tone does is improves sleep quality and quantity, and also reduces nightmares and flashbacks associated with the PTSD, again, especially with continued consistent use of the LUMNA Calm and Uplifted Elixir. What the product also does is helps to rewrite unhelpful scripts in the nervous system, and these feedback loops that are deeply ingrained in the nervous system, both in the central nervous system, so brain and spinal cord, and the autonomic nervous system that we've been talking about. And I'll get more into the nitty-gritty of that in a little bit. But essentially, it provides enough balance in the nervous system to be able to do the more challenging aspects of self-work, including therapy, self-care, diet, lifestyle changes, and other factors that improve global health overall. It also really helps to improve treatment response to other traditional and experimental healing methods, including psychotherapy, EMDR, the SSP or Safe and Sound protocol, ketamine-assisted psychotherapy or other psychedelic-assisted therapies, neurofeedback, mindfulness and meditation, yoga practices, and trauma-releasing exercises, things like that, or TRE is what that's called. So it really improves the response to all of those therapies, both acutely in the moment when triggers are coming up, and also over time as the nervous system is modulated into a more healthy, balanced state.
Thanks. So I find that people sometimes wonder if they should only use it when they're in an extreme state. And I know you mentioned, continued consistent use being important. And, I understand this, but I think it'd be great if you could share why exactly that's important.
Yeah, of course. So this goes back to kind of the LUMNA triphasic effects. So acutely, yes, it definitely helps in the moment when someone is feeling triggered, overwhelmed, anxious, unsafe, whether in the context of therapy or just daily life. So it will help with the symptoms in the acute phase. But chronically, especially when we get into the neuroplasticity component and the modulation of the nervous system, the continued use is really important for rewriting those scripts in the nervous system and for really deeply altering that the brain and central nervous system, as well as that autonomic nervous system response, so that there's more flexibility of the autonomic nervous system and we don't get stuck again in either the fight or flight sympathetic overload or that dorsal vagal shutdown of freeze and fawn. And with the nervous system, changes take a lot of time. Nerves in general, the cellular turnover is very slow. So it takes consistent use and consistent repeated application over time to really be able to affect the nervous system in the long term so that we get to that root cause and essentially discharge those unprocessed, unstored, or stored emotions from the system, and also to rewrite those scripts into a more healthy, balanced, centered way.